I was sitting in the exam room with hot, steamy tears streaming down my face in front of the patient. This was my worst experience ever as a nurse practitioner. So the question is, what in the world had me so upset that I'm sitting in front of the patient crying, visibly upset? I wish I could say it all ended well, but I said something I never thought I would ever say in a patient encounter. I don't want it to happen to you. I'm gonna share what happened, what I learned, and when you're still with me to the end, I've got a handy tool to help save you time in the clinic and help your patients feel better effectively. So the conversation just so happened to involve me telling a patient's mother that her daughter didn't need an antibiotic for her upper respiratory tract infection. Anybody ever been here? A traumatic experience or a confrontational encounter not needing an antibiotic when they're sick? So let me set this up for you, exactly what was going on. It was in the thick of sick season. So we were in between Thanksgiving and Christmas. You know how it goes. School gets started, kiddos start sharing all their germs, strep gets started, respiratory viruses, stomach viruses. And then when all these people get together at Thanksgiving, boom, it's like somebody poured gasoline on this fire. I was working at that time in retail health. In the throes of sick season, they were working super short. Tons of people who were sick couldn't get into primary care, needing to be seen. They were desperate for help. So I signed up to work a lot of hours. Towards the end of the week, they begged me to pick up at least a few hours on a Saturday at this clinic that was working short. I decided I would give them 4 hours. As a nurse, you are used to working 12, 13-hour shifts. You can do anything in 4 hours. Well, I'm sorry to say, I regretted in a lot of ways actually ever agreeing to take this shift. It was during this shift I had my worst encounter ever with a patient. At the same time, it also thrust me into some changes that I will never regret making with having these no antibiotic conversations, and it's going to help you as well. So in hindsight, kind of glad that it happened, but man, worst experience ever. So this patient on this day I had never met before and certainly hadn't met her mother. I had no trust built with these two. I'm in the room with this 15-year-old sweet girl, started the day before with sore throat, runny nose, feeling run down, no headache, no fever, no loss of appetite, no nausea, no vomiting, no diarrhea, no systemic symptoms. So overall, not terrible. I proceed to examine her, realize very quickly, okay, good news, just a simple respiratory virus. Bad news is nothing I can do to cure her. Sit down at the computer, start telling her what our game plan is, putting some notes in her visit summary. She's very accepting, sweet as could be. So of course I'm letting her know if an antibiotic would help you, I'd absolutely prescribe one for you today, but it won't. And I certainly don't want to put you at risk of side effects, nausea, vomiting, diarrhea, yeast infections, the list could go on. That my job was to definitely help her, and I was going to give her some symptom management recommendations. Well, while I'm in the middle of this, someone else joined us in the room. Here comes Mom. Now, I wish I could say that Mom hadn't joined us yet because she was parking the car or she had to go pick up a prescription at the pharmacy and use her time wisely while she had her daughter at the retail health clinic. But unfortunately, it was evident that this was not the case because Mom came in a little bit haughty, a little bit impatient, and her words to me were, "Hey, what's taking so long?" Let me just remind you, we're in the middle of sick season. I was picking up extra. This is a 4-hour stint, and this is where we are going. I tried to be friendly, be empathetic, and just say, hey, so sorry, we're almost done. I've checked your daughter out. I was just letting her know she doesn't need an antibiotic. She's got a respiratory virus, and I started to tell her what our game plan was. She just immediately is like, what? I know that she needs an antibiotic. That's why we're here, is to get an antibiotic. I'm trying to focus and make sure that I respond appropriately. I'm like, well, I understand that, but as it turns out, she doesn't have evidence of strep infection or any other type of infection that needs an antibiotic. It's clearly a respiratory virus, and an antibiotic won't help her at all. Trying to explain the same thing I was explaining to the patient cuts me off again. She is not willing to listen, and she is not happy. And at this point, to be honest with you, I have no idea what else she said, because I kind of just went deer in headlights and thinking to myself, is this real life? Is this really happening? Am I really experiencing this right now? Do we really have to go here? That's probably all that was running through my mind. I was sitting at the computer and I stand up, and all of a sudden I just feel these tears just welling up in my face, and I point to the door and I say, you need to leave now. And of course she stops and she's shocked. She couldn't believe what I was saying to her. She goes, you can't make me leave. And I said, you need to leave now. She paused for a minute. You can't make me do this. I'm going to call management. Whatever else it was that she said. And to be honest with you, in the moment, I didn't care. I don't deserve to be treated this way, and I just need this moment to end right now before something gets said that shouldn't be said. She actually decides to leave. I calmly close the door, and the daughter is sitting on the table. She's just utterly mortified. I sit back down at the computer to finish her visit summary. Tears just start streaming down my face. My face, I know, was blood red. It was flushed. It was hot. She just drops her head and slumps her shoulders, and she's like, "I'm so sorry. Oh my goodness, sweetheart. You do not owe me an apology. I need to apologize to you. I am so sorry. This visit has gone this way. I should be able to handle this better." And as I sat there typing and tears were streaming, I said, "I do want you to know I am taking the best care of you. I promise I'm being honest about what's going on with you. And if you needed the antibiotic, you would be getting the antibiotic. But I can actually do more harm to you by giving you one." And she was so sweet. "I understand." And I did apologize to her again, and she left the room. Now, there was a whole slew of events after that where I left, called management, had to explain what was going on. And it was after that experience that I decided this was never going to happen to me again. I would never be ambushed by a patient. Being prepared for a conversation is one thing. I need to be prepared for the conversation, the confrontation, the antagonism. If you've experienced this before, let me know in the comments. Let me know how you responded, what you learned, what you do differently now. A couple of things that didn't set me up for success in this scenario. One, we were in the peak of sick season. Our patients are tired, overwhelmed, they're exhausted. Christmas time is like the #1 time for heart failure admissions and heart attacks for a reason. The ridiculous amount of stress that we put ourselves under. The point being, it was not a good season. I was exhausted, didn't have an established relationship with these patients where they know me, they like me, they trust me. And then also, I had not crafted a conversation to where I knew what my responses would be to walk a patient through this conversation well. All of my retail health friends and urgent care friends, this is the exact reason you need to have clarity and confidence in delivering this conversation. I used to remember hearing them check in and say, "Yes, I just need an antibiotic." And I would just like drain from head to toe because I knew what was likely coming. The vast majority of patients who think they need an antibiotic actually don't. You have to navigate that conversation with them. Anybody know what that's like in retail health? Please tell me your story. Let me know in the comments. If you're struggling to craft this conversation, I want you to download my free guide, The Top 10 Phrases Every Clinician Needs to know when saying no to antibiotics. And this is going to help you begin to craft your conversation. I don't want you to be on the extreme where you are just telling people without any type of empathy that they don't need one and moving on. And you also don't need to be on the extreme of just handing out antibiotics to anybody who requests it or demands it. That contributes to, you guessed it, the worldwide issue of antibiotic resistance. I want to help you avoid this scenario, my worst day ever as a nurse practitioner. One of my previous partners and I used to say, we can do more with effective patient education than any pill ever could. And that is so true. If we're not building relationship, building trust, and connecting in the room, we're missing out on our most valuable asset to impact outcomes for our patient. So as promised, for those of you still here, I have a tool that I want to give to you to help you, whether it's sick season or allergy season, to save you time in the clinic, but maximize education for the patient. So I've created a step-by-step guide for how to administer nasal sprays. Nasal sprays can be effective, like corticosteroids, for patients with upper respiratory virus at times to help with that congestion, and definitely for those patients who come in and it's not an infection that they have, it's allergies that are causing their symptoms. Teaching proper technique is absolutely critical, especially for the medication to be effective, but time is also critical for us in the clinic room. Scan the QR code or click the link below, totally yours for free. My mission is to help you learn how to craft this no antibiotic conversation. Be sure to subscribe, share it with a nurse practitioner student or a nurse practitioner friend. We're in this together, and I'll see you in the next one.